So there are lots of videos at the moment about the injection points when it comes to botulinum toxin around the eyes. Lots of discussion about multiple injection points underneath the brow to give a brow lift, injection points around the edges of the outside. The important thing is that the orbicularis oculi muscle is a circular muscle which crunches down and in. So it essentially closes your eye tightly. That's what the orbicularis does. Now, whether you put 3 injection points along here or 1 injection point just underneath there, and various other positions will determine the contraction ratios of the inner portion of the orbicularis compared to the outer portion of the orbicularis. The important thing to get an eyebrow lift, which nobody is actually talking about, is you have to maintain some upwards movement. So if you paralyze your forehead, it doesn't matter if you do any injections in this section, you will not get a brow lift if you cannot raise your eyebrows. So that's a really fundamental point, and there are risks with Botox. There's always a trade-off. So your risk of a droopy eye actually increases the more injection points you have below the eyebrow. So I basically don't recommend it. If you stick to the outside portion, so this is called the lateral canthus. If you're outside the lateral canthus, the risk of you getting botulinum toxin spreading to your levator palpebrae, which is the muscle that keeps your eyelid open, is very small. So all of these muscles interact. The whole point about Botox is it's a trade-off. It's one interacting muscle traded off against another interacting muscle. It is not simple. Botox is easy to do, but incredibly hard to do well. So that's just my little bit for today, a little bit of a rant, because there's so much stuff going on social media trying to dumb down how important these treatments are, and it's always better to be cautious. It's not as easy as it's made out to be.